If naloxone is given to someone who hasn't taken any opioids, it would just have no effect at all. It just goes to the receptors, but it doesn't generate any negatives, and then it'll wear off quite quickly, so there's no concern in that regard. Naloxone can be safely given to children and pregnant women. If they've not taken opioids, it's the same as an adult or someone who's not pregnant. There just would be no negative effect. So it's not something you need to concern yourself with. And the dosages, even for children, are fine because it's very rapidly eliminated from the body. Naloxone is so short-acting that it's not going to interfere with other medications. It would if you tried to take an opioid in that short time window when you had naloxone on board, because it attaches itself more strongly to the receptor. So it would block a pain medicine or heroin from going to the receptor for 20, 30, maybe even up to 90 minutes. But after that effect wears off, but that's the only effect I can think of that would be considered, but it's really not applicable. The typical expiration time frame for the nasal spray or the muscular injection form is 18 months. If for some reason you noticed afterwards that you gave an expired medication, there would be a slight risk that it had lost its potency, particularly if it hadn't been stored at room temperature or it had been exposed to light. In those cases, it could actually lose its potency more quickly and not be as effective. So that's why it's important to check the expiration date and get a new prescription. If naloxone is given to someone who, say, is not breathing or is unconscious from an alcohol overdose or a sedative or sleeping pill, naloxone would not make that worse. It would just have no effect because those substances or medications go to different circuits in the brain. So it's not something that you should worry about. There are no age or weight limits when administering naloxone per se, because mainly it's going to be given to adolescents, younger or older adults, and so they have sufficient body weight. The dosage is designed for bigger persons, but there are no negatives to giving it to someone who's smaller. It could happen that a small child could overdose by drinking liquid methadone, say, and if someone happened to have naloxone around, you would definitely want to use it, even if you didn't think that that was the reason that you were going to use it. That's a clinical opinion. We encourage persons who are struggling with addiction or heavy use to come in, get the training, and get a certificate, because the more people that know about the risk of overdose, the more likely that lives will be saved in our community and across our state. One good way would be to ask the individual, what's your pattern of use? Have you ever overdosed? Are you worried that you might be at risk of overdose? You could also ask the people that they hang out with, is my son or daughter at risk of an overdose? You could call your local treatment facility and talk to one of the counselors there and ask him what are the common signs of heavy use or addiction. So reach out to others if you don't know the answer, ask questions, become more informed, and then I think you'll be in a good position to know whether you should seek a certificate.